Today we're going to discuss the immense problem of heart disease, as well as an exciting new study showing that a breakthrough nutritional product can provide unparalleled benefits. Hello, my name is Dan Austin, and I'm a registered nurse at the High Desert Heart Institute. As a clinical care coordinator, I'd like to introduce you to Dr. Siva Runasalam. Hello, Dr. Siva.
Hello, Dan.
Please, Dr. Siva, can you tell us a little bit about yourself?
Dan, I've been in cardiology practice now for almost 20 years. I did my medical school in Emory University in Atlanta, Georgia. Did my residency in internal medicine at UCLA. And then went on to do my cardiology fellowship at Cedars-Sinai Medical Center. After completing my training in cardiology, I started my own private practice. And now I practice in Southern California in a small town called Victorville, where we see approximately 25,000 patients on a regular basis, and we take care of all aspects of cardiology.
And that would be at the High Desert Heart Institute that you founded. Is that correct, sir?
That is correct, Dan.
What makes the High Desert Heart Institute different than other facilities in that area, Dr. Siva?
We are not truly different. There are a lot of clinics throughout the country that do what we do, but we're kind of unique in the sense that we are the only one in Southern California that kind of approaches cardiology in a very comprehensive manner. In our facility, we provide very comprehensive approach to cardiovascular diseases. We take care of patients from all the way from hypertension, diabetes, to patients with very advanced heart failure, where they eventually go on to even get heart transplant.
Now, can you also tell us a little bit about your background also in interventional cardiology?
We are a complete cardiology facility. That means we provide every aspect of cardiology. In our own facility, we do have all the necessary advanced cardiovascular modalities that needs to be available to provide really good cardiology care. We provide CAT scans or CT scan to look at cardiovascular anatomy. We provide echocardiography to look at, it's an ultrasound, to look at how heart muscles and valve function. We provide laboratory examinations in our facility where we can take and look at patients' cholesterol profile, look at how the kidney function is. We also provide treatments such as congestive heart failure clinic, where we provide not just medication, but we daily monitor patients on a regular basis, where nurses like yourself are present and implement acute treatment when patients decompensate. That means they're not doing well with regular medication they are taking at home. We bring them to our clinic on a regular basis, a regular interval, where we give IV infusions of medications to help the heart function. Only when we fail to take care of them in an outpatient basis, in rare occasions, those patients then will have to be hospitalized in a hospital setting.
Also, too, Dr. Siva, can you tell me also about some of your other expertise outside of the Heart Institute and some of the other teaching that you're also doing also?
We are in a unique situation that because of affiliation with the local hospitals, we are able to bring physicians from all over the country to have hands-on training in certain aspects of cardiovascular intervention. I'll give you an example. About 4 times a year, physicians from all over the country come to our hospital, where we actually give them training on how to do angioplasty to the arteries to the brain, which is a carotid artery, which is a very advanced stenting process that we do. And you need very advanced training before you are eligible to place stents in the carotid. And we are one of those rare facilities that we can actually train cardiologists or radiologists or surgeons to come in and have the training done by us.
Dr. Siva, when I first met you many years ago, working at one of the local hospitals when I was working in the emergency room and later working in the intensive care unit, I had the opportunity to see really firsthand and to get hands-on training and working with you with patients who would come to the emergency room and then going to the cath lab who had acute heart attacks, or we called acute MI. Many times they had what we called STEMIs in those fields, and we were rushing them to get quickly to go to the cath lab to save these people's lives. And when I had that opportunity working with you, this was basically around really the number one killer in the country, which is heart disease. And so I'd like to take a moment and talk about the problem of heart disease or heart dysfunction, as we may call that. Can you talk a little bit about the cardiovascular system and why is cardiovascular disease the number one killer still in our country today?
Yes, Dan, of course. Cardiovascular diseases in general, or myocardial infarction in particular, which is heart attack in lay terms, kills about 500,000 Americans every year. It is the leading cause of death in this country. If you add breast cancer, HIV, and you add lung cancer, all added together is less than the number of people who die of heart disease every year in this country. The causes of heart disease is actually a tremendous number of risk factors have been identified. The most common risk factors are tobacco use, obesity, high cholesterol, high blood pressure, and age, as well as genetics predisposition. Now, we have now slowly but surely have got a grip on tobacco use. There are fewer and fewer people smoking, especially in California. You cannot actually see many people smoking in public anymore because of all the regulations that's gone into effect. But we have another problem that's emerging, that is diabetes. We also now see a large number of patients who are overweight, and that number has gone from 14% in our population to almost 24% in the last just one decade. So what it tells you is we have now shifted from tobacco being a leading cause of cardiovascular disease, now obesity and diabetes. And diabetes is now listed by CDC, that is Center for Disease Control, as an epidemic. It's the only non-infectious disease that is now being recognized as an epidemic. So if we do not get control of diabetes, do not get control of overweight, we are going to continue to have problems of heart disease. And it's a premature killing of death of patients in this country. We are now seeing children at the age of 14, about 20% of them are overweight. So it's a time bomb. We have to do something about it. So the risk factors are clearly identified. Now, what do we do to reduce those risk factors? We cannot change what we inherit from our parents. That's not possible. We cannot change the aging process. We all are going to get older. What we can change is what we put into our system. What do we eat? What type of nutrition do we take? How do we control our weight? Those things we can change. And if we do that early enough and do it aggressive enough, then I think we will have a better handle on heart disease and other disease process as a whole.
Now, you were talking about just on cardiovascular disease. As a society, we've come to expect what many people call a quick fix. We want a pill to solve, all of our problems immediately. While drugs and surgery can be very helpful, we, as you point out, we should look to improve our diets, exercise more, improve our lifestyle first. What do you see are the best ways that people can protect their cardiovascular system?
Dan, there's so many things that we can do. If you look at a patient's artery, right from the age of 6, you can see changes of cholesterol building up in our artery. So what we do in childhood, that means as parents, what do we give our kids is going to impact those children 20, 30, 40, 50 years from now. So nutrition is going to play a major role. As we understand pathophysiology, how the disease process of atherosclerosis is evolving, we understand nutrition plays a role. We understand lifestyle plays a role. There is no magic bullet. We have to make changes in our lifestyle. And if we make the changes early enough and stick with those changes, I think the benefits are going to be here 30, 40, 50 years from now.
Also, when I was talking about working with you in the emergency room, many years ago, one of the things that I noticed that several of your patients, certain type of patients that you had that would be coming to the emergency rooms, were on a nutritional supplement called L-arginine, and I remember asking you in later on when I would see you either in the intensive care unit or later on in the emergency room, I asked you, I said, what are the you have certain patient populations, Dr. Siva, on a supplement called L-arginine, and you would tell me that that these patient populations were quite ill. They would have either diabetes, hypertension, small vessel disease. You'd already done intervention on them with regards to stents, angioplasties, but you had put these patients on L-arginine for specific purposes. And this was many, many years ago, back in the year 2000, 2001, 2002. Can you talk a little bit about some of the studies that may have been done and how long L-arginine has been out in looking at the benefits for cardiovascular disease?
L-arginine is a precursor. It's a nutritional precursor to a compound called nitric oxide. When I was taking my interventional boards in 1999, I was going through numerous articles looking at how to improve circulation. And one of the articles that I came across was the use of L-arginine to improve circulation in the microvasculature. Let me explain what I mean by that. Just like branches to a tree without the leaves in autumn or in fall, our branches of arteries in our system, any organ system, including the heart, is just like the branches of a tree. You have a big trunk that divides into smaller trunks and divides into smaller branches. The smaller branches becomes even smaller, then eventually becomes twigs.